Capnography is now used more and more in a variety of places. It's been used in the operating room since the 1980s. It's now being used throughout the entire hospital. But for anesthesia, MAC anesthesia is still a challenge. Several anesthesia providers still take an oxygen mask and they will actually input a Gelco catheter or an IV catheter into the mask, and then they will attach their sample line onto the end. Now the problem with that is occasionally the sample line can get touched, and they sometimes tape it in or sometimes drive it in, and what happens sometimes that gets dislodged and you get an alarm that says there's no CO2. The other problem is it gives you the presence of CO2, but it doesn't give you a good end-tidal reading or a good CO2 waveform. With the CAPNOXYGEN mask, you are able to securely attach it via a lure lock right here on the mask, and you're providing oxygen, 6 liters plus of oxygen to your patient, but the entire time you're getting an excellent CO2 waveform. So the CAPNOXYGEN mask is available as a great provider of CO2 monitoring and oxygen to the patient for capnography and for your MAC cases or monitored anesthesia cases. There's a program going on right now where you can deliver, or we can provide a capnography monitor such as this for no charge. The capnography monitor comes with the nasal cannula that I'm wearing here. This is called the Comfort Soft, and it's Comfort Soft because the tubing here is ultra soft. So when I put this on and cinch it in, it's not only very comfortable and it kind of adheres to the face, but it doesn't get dislodged. Often when you're using cannula that have real stiff tubing, the tubing will pop up and pop off, and the next thing you know, you're not centered under the nose and you're going to get an alarm because there's no CO2 and your patient's not getting any oxygen. With the Comfort Soft, you virtually are guaranteed that when you place it and cinch it up, it's going to stay there. The patients like it, the clinicians like it, and it gives you good readings. It's also available in a nasal and oxygen, or nasal and oral sampling system. So this would sample CO2 from one side and provide oxygen from the other, and then it's going to sample CO2 also from the mouth. So it's available in a couple different ways. This is the nasal only version. This is the nasal and oral version. Once again, we provide this monitor at no charge, and in return for you purchasing your capnography supplies from Bell Medical. Thank you.